Hello friends, welcome back to the channel of Clinical Care Insight. We started a series of lecture on reproductive system. Until now we studied about the basic, you can say, anatomy of reproductive systems, both male and female. We also seen about the functions, the reproductive parts functions. We seen the major events which is occurring in the you can say the reproductive system of male and female. We talked about the gametogenesis in the case of female, we seen oogenesis in the case of male, we seen spermatogenesis, and in the female undergo one you can say the monthly sexual cycle that is called as the menstrual cycle. So we have the details lecture over the menstrual cycle, and after that we seen about the fertilization, the fusion of these two gametes, okay, and then we also seen about the, you can say, how this fertilized product, that's a zygote, undergo the successive cleavage and get implanted to the reproductive environment of the female. That's called the implantation. Okay, we seen after the implantations we seen the placentations, we seen about how female reproductive systems, the pregnant female reproductive systems undergo the changes. We seen about the structural changes, we seen about the metabolic changes, we also seen about the, you can say, physiological changes. Okay, fine. And in today's lectures we will deal about the, again we will deal with the pregnancy, but now it's time to discuss about the developing fetus. Okay, developing fetus. So here is today's lecture outline. First we will go with the understanding what is the mean by the fetus, then about the gestational age, how the developing fetus age is determined when the fetus is inside the mother's womb, then how we can calculate the age. Okay, then we will see about the embryonic age. We will also see how the length of the fetus will measured. Okay, then we will see about the growth of the fetus, we will see about the fetal physiology. We already seen that maternal physiology undergo the changes during the pregnancy, during the gestation. Now in today's lectures we will discuss about the fetal physiology, how fetal physiology is developed. Okay, then we will see about the germ layer and their derivatives and amniotic fluid and umbilical cord. So this is today's our lecture outline. I hope you all are fine, well, because we have to find, like there are so many fluctuations which is occurring in our life, but we have to practice the patience. It's only remedy to be a successful, be excel in our field, isn't it? So have some patience. Now come to the point, make the heading about the fetus. So how you will define the fetus? Who is the fetus? Yeah, there's two things you have to define. First one is embryo. Okay, another one is called fetus. So how you are defining the embryo and the fetus? Yeah, embryo is a premature, you can say, the product of fertilization. It's a premature product of fertilization, or you can say after the fertilization. After the fertilization till the, yeah, till the 8th week. Write it down. After the fertilization, okay, till 8th week of pregnancy, till the 8th week of pregnancy, the conceived product, okay, the conceived product is called as the embryo. Got the points? The conceived product, the product which is, you can say, obtained by the fusion of female egg and, yeah, the male sperm. Okay, it's result into the one multicellular structure called as zygote, isn't it? Now this zygote, they undergo the division, okay, until the 8th week. This all division structure is considered as the embryo, and this process is called as the embryogenesis. Formation of embryo is called as the embryogenesis. Okay, this is called as the embryogenesis. Now, about the fetus, it's easy. After the 8th week, okay, till the entire pregnancy, you can say the reproductive viable product is called as the fetus. Okay, so some book write it's 10th week, so you can write from the 8th week or 10th week till the full term is called as the fetus. Full terms denotes like overall, you can say the overall pregnancy. You know that the human pregnancy is about average, if you're taking, it's a 37, but it varies. Yeah, it varies. It's up to 36 to 42 weeks. Okay, 36 to 42 weeks. It's about the pregnancy, you can say date, the pregnancy duration, 37 week. So till the 8th week, starting from the 8th week till the full term, means till the 37th week, you can say the developing fertilized product is called as the fetus. It is called as the fetus. Now, this 37th week, it is also described in the trimester. Okay, in the trimester way. This 30 weeks is divided into the 3 trimesters. Okay, and one trimester means 3 months. Okay, one trimester means 3 months, means first trimester, second trimester, and we have the third trimester. Okay, so all these trimester you can calculate. If the one trimester is about the 3 month, another is also about the 3 month. Okay, and another one is also about the 3 month. So total human pregnancy, human female pregnancy we talked about, it's about the 9 month. It's modern calendar says it's 9 month plus minus 7 days. Got the points? Yeah. So this is a trimester type of classification, and each trimester is marked by the different kind of development. Each trimester is marked by the different kind of, you can say, the development. Fine. So once we describe the embryo is what? It is after the fertilization till the 8th week, whatever the conceived product is, it's considered as a embryo. Okay, and this formation of embryo is called as the embryogenesis. Then about the fetus is after the 8th week or 10th week, okay, till the full term of pregnancy, it is considered the developing, you can say, the product is considered as the fetus. Got the points? No problem. Now let's define one age called as the gestational age. Gestational age. So gestational age is the duration, okay, is the duration, you know. First thing we have to understand here is that whenever a female conceive, okay, whenever a female conceive, she missed her periods, isn't it? She missed her periods. Why? Because we've seen that the female reproductive systems undergo the endocrinological changes. Okay, her hormones is, you can say, altered. during the, you can say, if there will be a you can say the ovulation, in the mid of the menstrual cycle there is the ovulation on the 14th day. Average 28 day cycles, ovulations occur on the mid of the cycle, 14th day, okay, due to the surge of LH hormone. This is clear in our mind. The things which also we discussed in our previous lecture is that after the ovulation there is a chances for the fertilization. So if there will be a fertilization, then the, you can say, corpus luteum, they will secrete certain hormones, okay. The corpus luteum, they will secrete some certain hormones which will going to give the negative feedback to the hypothalamus that don't secrete the FSH and LH. And you know that the follicular cells is dependent on the follicular stimulating hormones for their proliferation, for their overall growth. So if there will be a no FSH, no LH, then the female, you can say, the follicular changes in her ovary will stop, with ceased, isn't it? It means if female will conceive, it means there will be no menstrual cycle. Fine. So the last, you can say, menstrual period called as the LMP, okay, called as the LMP. So from the LMP, that last menstrual period, okay, till the entire, you can say, the gestation, entire pregnancy, this time period is called as the gestational age. Got the points? Yeah. So last menstrual period, when the female missed her last period till their pregnancy, the full term, you can say, the pregnancy, the full term gestation cycle is called as the gestational age. Fine. And there is one more age, okay, there is one more age called as the embryonic period. It's the gestational period. Another one is gestational age, or you can say gestational period. Another one is embryonic period. Embryonic period. This embryonic period started with the formation of the embryogenesis, and it is, you can say, happen in the third week. Okay, it started to the third week till the 8th week, because after the 8th week there will be a fetal development, okay, there will no any embryogenesis. So starting from the third week to the 8th week, this time period is called as the embryonic period. This is called as the embryonic period. Now, on the, you can say, how we will define the age of the fetus. Yeah, age of the fetus. So age of the fetus, or you can say the chronology of the fetus, is defined in terms of the gestational age, not the embryonic period. Yeah, whatever the gestational age is, the same applies to the age of the fetus. If gestation is about the 2 week, it means the age of the fetus is about the 2 week. Are you getting the points? Yeah. So the gestational age and age of the fetus is closely related, or you can say both are synonymous. Okay, both are the synonymous and alternatively used. So defining the age of the fetus, we have to understand the gestational age. First we have to mark the date of the female, the pregnant female last menstrual period date, okay, until the whole pregnancy it is considered as the gestational age. So this is about defining the age of the fetus. So you should write it down that the age of fetus is defined in terms of the gestational age. Gestational age. No problem? Now, once we understood about the gestational age and embryonic age, we also defined the age of the fetus. Let's move ahead and describe how the length of the fetus is determined. How? You know that fetus is inside the mother's womb, Okay, and we are in a modern era. We have high resolution imaging techniques. We have the high resolution imaging techniques via which we can see directly the status of developing fetus, status of the developing fetus. So one of the imaging technique is called as the ultrasonography. Okay, write it down. This is called as the ultrasonography. Ultrasonography. Okay, this ultrasonography is a imaging technique, okay, which generate the real time image. It generates the real time image. It uses the one ultrasound probe, okay, which is inserted through the vagina, okay, and it generates one sound wave. Okay, and this sound wave is interpreted on the screen on the monitor, and you can say physician can diagnose, okay, can diagnose the status of developing fetus, okay, status of the developing fetus. So one way to define the length of the fetus is called as the crown rump length. Crown rump length. Crown rump length. Okay, it is the one way to define the length of the fetus. It means what is happening here. Here crown means head part, okay, and rump means the the distal most part of the developing fetus, the end part of the fetus, and this length is measured under the ultrasonography. And this ultrasonography, if we talked about the in context of the female, it is called as the transvaginal ultrasonography. You should write it down, these terms, because this is important. This is called as the transvaginal. Why called transvaginal? Yeah, because it's inserted through the vagina. Transvaginal ultrasonography. There is so much, you can see, it is extensively used in the field of OBG, or called as obstetrics. Okay, do you heard about this branch? Yeah, there are three different branch which is related with this pregnancy, reproductive system, and taking care of the child. Okay, I must define these terms where I write it. You got these points? Now I'm going to rub this. Okay, come here. We have three branch in the medicine. Okay, we have the three branch in the medicine. The first branch is called as obstetrics. Okay, OBG pronunciation is a bit difficult for me. Is called as the obstetrics. Okay, obstetrics. Another one branch we have is called pediatrics. Okay, and another branch in the medicine we have is gynecology. Now, generally you can say a layman is not confused in these three words. They are using simultaneously. They are thinking these three words are the same. But as a medical student, okay, as a healthcare student, we have to define these terms clear cut. OBG or obstetrics, it deals with the pregnancy only. It is a branch of medicine. This is a specialized branch of medicine which deals with only the pregnancy. Pregnancy. It's about the OBG. Now, about the pediatrics. Pediatrics is a branch of medicine which will monitor and provide the, you can say, you provide the care for infants, child and adolescents. Mark the words, infant, child and adolescents. So taking care of these all age group is by one special branch in medicine called as the pediatrics, okay, and practitioner is called as the pediatrician. Practitioner is called as the pediatrician, okay. No problem. Now come to the gynecology. Gynecology is a specialization in medicine, okay, which focuses only to understand about the female reproductive system, okay, female reproductive system. Got the points? No problem. So once again, OBG or obstetrics is a branch of medicine which deals with the pregnancy. What is mean by the dealing with the pregnancy? Dealing with the pregnancy means to overall care, providing the overall care starting from the defining, the first is diagnosis that the female is really pregnant, okay, because there are some signs and symptoms which is similar to the pregnancy, but that's called the pseudo pregnancy or false pregnancy. This is not actual pregnancy. So first thing is to diagnose the pregnancy, that really a particular female is pregnant, okay. Another one is defining this gestational age, okay, taking care the, you can say, the imaging, ultrasonographies, about the other, you can say, the diseases. There are a broad spectrum of the diseases in the OBG, okay. Most of are, you can say, the developing defects, okay, which is you can say specifically deal with the help of ultrasonography, which specifically deal with the ultrasonography, and about how to manage those disease condition, how to, you can say, optimize a pregnant woman health status, her physiological, you can say, conditions. So all these things it dealt in the OBG. In the pediatrics, it deals after the birth, isn't it? It deals with after the birth, and after the birth till the adolescent, whatever the age group is in between, that is taken care by this pediatric branch, okay. Then we have the gynecology. This gynecology is specialized to deal with the female reproductive system, about the diseases, you can say sexually transmitted diseases, other problems. Sometimes there will be a cancer, okay, there will be a cancer, and most profound cancer is in breast cancer, okay, and about the cyst formations, okay, abnormal, you can say, discharge. These all are dealt in the branch of gynecology, okay, in the gynecology. Understood? Now where we are defining the transvaginal, we are defining the transvaginal ultrasonography. We said that transvaginal ultrasonography is one of the imaging technique which is utilized to see the viable fetus, okay, to see the viable fetus, to see the development of the embryo of the, you can say, the fetus, okay. Generally the ultrasonography is started like it must, you can say, started, or it should be started in the second trimester, but if it started earlier, imagine earlier, before, in the starting from the first trimester, it's very useful also, okay. But this ultrasonography, no doubt, it's a amazing technique, it's an awesome technique to see the fetus, to see the female, you can say, pregnant female reproductive system. And but you can say there are certain, a few a problem is there. The first thing is it cannot, you can say, generate the image of minute changes in fetal development. Minute changes in terms of, sometimes there is a congenital deformity, congenital, you can say, anomalies, okay. Sometimes there will be a neural tube defect, okay. Sometimes there will be a genetic problem, which is, you can say, in ultrasonography, doctors are not, you can say, clear to diagnose, okay. So in that time, this ultrasonography, you can say, will fail, and these are certain, you can say, problem related with the ultrasonography. So there is one more technique started in 1983 and called as the fetal MRI, fetal magnetic resonance, or that is called as the fMRI, or in full it is called as the fetal MRI. So it is the one of the imaging techniques. Okay, why it is better? Because it's detect the minute changes first of all, and the second thing is it not you can say emit any kind of radiation. Fine. And yeah, it's expensive, but it's help. Okay, it's come into the picture when there will be a certain suspicion of some of the, as I said, some of the, you can say, developmental congenital disease, some of the neural defects, some of the genetic problems where the ultrasonography is failed to explain, then the fetal MRI is best. Okay, fetal MRI is best, understood, and its utilization is should be on the second trimester. It's also diagnosed some of the, you can say, the link, you know, that from the developing fetal there is one vessels. Okay, not a vessels we can say, but that's called the umbilical cord, which is attached with the, one end is attached with the anterior end of the placenta, and one end is attached with the umbilicus, navi, called as nucleus of the fetus. Okay, so sometimes this umbilical cord develops some kind of cyst, okay, which is very, you can say, detrimental for both for the child and mother. So that diagnosis is also used in the case of fetal MRI. Fine, no problem. Now, once we define all this, just quickly recap. We define that the fetus is a developing, fertilized, you can say, the conceived product. Okay, when from the 8th week till the full term of the pregnancy. And about the embryo, so after the fertilization till the 8th week, the product is called as the embryo, and this formation is called as the embryogenesis. Okay, then we seen that the pregnancy is divided into the 3 trimesters. The overall human pregnancy is about on an average the 37 week, but you can say it can be varies to 36 to 42 weeks. Okay, and first trimester is about 3 months. So there is a 3 trimester means 9 months plus minus 7. This is the modern calendar. Then we define one age called as the gestational age. This age denotes the fetal age. Okay, how we define the age of the fetus? How we calculate the fetus? By calculating the gestational age. Gestational age is about to establishing the judgment about the last menstrual period of the female. Okay, till the her whole pregnancy. This time period is called as the gestational age. Then we define one more age called as the embryonic age. Embryonic age is marked by 3rd week to the 8th week. Okay, and then we seen, okay, how we will define the length of the fetus. Okay, the length of the fetus is defined by one you can say one technique called as the crown rump length. Okay, crown rump length means calculating the measurement from the head to the distal end of the fetus, developing fetus, and this is, you can say, done by the help of ultrasonography. One of the ultrasonography is transvaginal ultrasonography. It generates the real-time image. It utilizes probe. Okay, and this probe is inserted to the vagina, and in the monitor this is appeared. Okay, and then we said this transvaginal ultrasonography started in the first trimester itself, but the second trimester is, you can say, second trimester is optimum to use. Then we seen that the fetal MRI. Okay, why the fetal MRI is, you can say, best over the ultrasonography? Because it detect the minute changes. Okay, then we define that there are different branches in the medicine which mainly, you can say, deal with the overall pregnancy, reproductive system, and taking care of the child. The first one is OVG, or also called as obstetrics. This obstetrics only deal with the pregnancy. Then we define the pediatrics. This pediatrics deals with providing the care, or you can say providing the treatment, management of infant, child, and adolescents. Then we define gynecology. It's a branch of medicine which deals with the, yeah, very good, it deals with the female reproductive system. Now, once we define about the fetus, gestational age, embryonic age, length of the fetus, age of the fetus. Now it's time to talk about the growth of the fetus. How a fetus is growing. Till here, do you have any doubt? Yeah? No? Very good. If you have any queries, any doubt, you can comment down. We will answer your queries. So how we will define the growth of the fetus? Yeah. How cell is growing? How the cell is growing? The question is that how cell is growing. You know that cell will grow by cell division and cell differentiation, isn't it? One cell will grow by the cell division and cell differentiation. So we are now defining the growth of fetus. Growth of the fetus is defined initially called as cell hyperplasia. Okay, then continued with the hyperplasia, followed by hyperplasia, followed by hyperplasia. Okay, and this is followed by hypertrophy. I will define these terms. Hypertrophy. Okay, and after this hypertrophy, the all entire full term development is dependent upon the hypertrophy. So initially cell will grow by increasing their number, by increasing the cell number. You know, one cell become 2 cell, 3 cell, 4 cell, 5 cell and 6 cell. This type of growth is called as the hyperplasic growth. Okay, this is called as the hyperplasia growth. So initially the developing fetus cell is grown by the hyperplasic growth, increase in the cell number. Okay, this is again followed by the hyperplasia. Okay, again only the cell grow. Then there will be a hypertrophy, means whatever the increment is done in the, you can say, the cell, now it have to grow larger. So this growing the larger, enlarging the cell size is called as the hypertrophic growth. Okay, it's called as the hypertrophic growth, and this hypertrophic growth is again followed by the hypertrophic growth. So this is the one pattern. This is the defined pattern of fetal growth. Okay. Now you know that the growth of the fetus is dependent on the two things. Okay, half of the you can say growth period is determined, or you can say the controlled by genetic factor. Write it down. Half growth period is determined by the genetic factor. Genetic factor. No problem. Now another half of the cycle of the growth, okay, growth period is determined by the environmental factor. Environmental factor. Okay, and you know how. See, first thing you have to understand, there is some criteria which is defined. The first thing is a taller or healthy mother give the healthy child. Healthy child. Okay, no problem. Now the another thing which we have to understand is that if we talked about the Indian baby weight criteria, okay, it is varies to 2.5 kg to 3.5 kg. Okay, this is a weight of Indian babies. Okay, Indian infants weight is about the 2.5 kg to 3.5 kg. Okay, so one of the half growth period is defined by the genetic factor, okay, and another by the environmental factor. So if there will be any chromosomal anomalies, if there will be any chromosomal impairment, okay, that lead to the, you can say, the abnormal growth of the fetus. Okay, and environmental factor also help in the growth period, and the main thing which is really helping is the hormones. Okay, don't forget about the hormones. You know, hormones are intracellular messengers. Okay, and these hormones, mainly the prolactin, ACTH, okay, growth hormone, and the insulin growth factor called IG1. These hormones is very necessary for intrauterine growth as well as, you can say, the postnatal growth. There's two terms called as the antenatal and postnatal. Antenatal and postnatal. Antenatal means the time period when the fetus, when the child is inside the mother's womb. All this period is called as the antenatal. Okay, postnatal means after the birth. Okay, so both the antenatal and postnatal, you can say, growth is dependent upon these circulating hormones called as prolactin, ACTH, growth hormone, and IG1. Okay, called as the IG1. So it is about the growth of the fetus. Okay, it is called as the growth of the fetus. Fine, no problem. Now once we defined about the growth of the fetus, let's move ahead and first understand that how the fetal, you can say, physiology is developing. So before describing the fetal physiology, first we will deal with this amniotic fluid. Okay, deal with the amniotic fluid and about the umbilical cord and germ layer and their derivatives, and after that we will deal with the fetal physiology. Okay,